In the bustling Interlake community of Arborg, there's a buzz on the street as residents run errands. We went there to talk to people about their emergency department. Mom of two, Caitlin Chorney, stopped to share her thoughts. Tell us about the ER services here.
There is none. I've had to go to Gimli, I've had to go to Stonewall. I personally had to go to Selkirk.
The ER was closed during our visit, as it was for most of 2023. Mayor Peter Duick lives right across the street and is reminded every time he walks out his front door.
If you zoom in on the sign there, you'll see emergency services not available today. That sign seems to be out there almost 30 days every month, and that is a problem for the community.
Arborg isn't alone. Across Manitoba last year, rural emergency departments were shut down for more than 80,000 hours, the equivalent of about 3,300 days.
I'm shocked that the number is that high when you put it in those terms, and the number of days and the number of hours.
Dr. Nichelle Desolé is a rural family and emergency physician in Neepawa and board director with Doctors Manitoba. She says when ERs are closed, that's time patients and their families are left living with uncertainty.
When their local emergency room is closed, I'm sure it's stressful to think, what if I'm feeling unwell this weekend? Where am I going to go?
Staffing shortages are plaguing ERs across Manitoba. 4 ERs closed their doors indefinitely last year after struggling to stay open. Leaf Rapids was last open in July 2022. Carberry's ER shut down in the summer. Melita and Morris closed September 1st. Arborg's ER stopped taking patients November 6th after shutting down 72 other times in the year. It had the second longest total closure in the province. The Interlake Eastern Regional Health Authority says people in the Arborg area having a health emergency should call 911 to be taken to a different ER. The closest one is in Gimli. That's a 30-minute drive from Arborg. Selkirk is an hour away. That's where most people go. It's a trip the mayor says most people make by car rather than calling an ambulance. Duick says many worry they'll have to wait for an ambulance.
It's only a matter of when, not if, someone is going to need the ambulance, and it will be an hour out of town.
Manitoba Health Minister Uzoma Asaguera says the government is committed to rural health and rebuilding relationships with doctors and nurses. But Manitoba emergency physician Dr. Alex Chachinoff says an ER that's open off and on isn't really an ER. While many towns feel they need one to be safe, it's not always possible.
And it's put governments in a difficult position where they feel a need to support sometimes more ERs than they have the capacity to.
And he argues patients can get better care at ERs in larger centers. Josh Crabb, CBC News, Arborg.